Welcome, everybody. We even got Ann Siebert out. Yeah. Hey, thank you so much for joining us here today. And I just want to say, without you, we would not be here at this moment. So as your governor, I am honored to have you here. And I can't tell you how much I appreciate the hard work that you've done to get us to this point. I'm not going to make the mistake of doing the thank yous, because we'd be here for 48 hours. So you know who you are. Thank you from the bottom of my heart. We gather here today to launch the first single-payer healthcare system in America. To do in Vermont what has taken too long. Have a healthcare system the best in the world that treats healthcare as a right and not a privilege. Where healthcare follows the individual, isn't required by an employer. That's a huge jobs creator. Where we all win and we all pay. Most importantly, a healthcare system that is sustainable, that spends our healthcare dollars making Vermonters healthy, not on insurance company profits and not on waste and inefficiency. We will get this done in Vermont. We have a few challenges, and I believe that taking on tough issues, getting tough things done, is going to lead to a bright future for jobs and economic opportunities for all Vermonters. As a business person who comes to this job as governor from small business, I know firsthand that the biggest obstacle to job growth is the 10, 20, 30% increases in insurance premiums, where we as employers who so badly want to cover our employees consistently send more and more money to insurance companies for less and less coverage, asking Vermonters, our employees, to pay more and more of their share in an unsustainable system that will both bankrupt us and make it impossible for our small rural health care providers who do such a great job delivering quality care to survive in a small rural state. Our hospitals, our doctors, our nurses, our diverse healthcare community, along with our small businesses, cannot survive under the current system. That's a big one. We need to fix it. This bill will. Say a word to the many Vermonters that I meet every day. The 40,000 who have no insurance coverage and wake up every morning wondering whether this will be their day. The 150,000 Vermonters, that's 1 in 4 Vermonters, who wake up every day knowing they have insurance, but knowing that they're underinsured. That if they really get sick, and eventually, unfortunately, we all do, that when that day comes, they may lose their house, their car, their economic security, because underinsurance is no insurance at all. That's what we need to fix. So this bill that we will sign shortly is both an opportunity and an obligation. It's a challenge to all of us to design a cost containment system that'll work. Folks keep saying to me, well, you got to ration care. You got to pay your health care providers less. I keep saying, no, it's not about reducing care. It's about paying our providers enough so that they can thrive, so that our doctors and nurses and healthcare providers can do healthcare again, instead of being second-guessed by insurance companies and under-reimbursed by a healthcare system that is driving them out of practice. Healthcare providers want to do what they were trained to do, make you healthy. This bill is going to give them the chance to do it in Vermont. It's going to bring them to Vermont. It's going to allow them to do what they were trained to do, deliver quality health care to Vermonters. Let's get that done. We wouldn't be here today without the help of many of you. And I'm going to first take my hat off to the Vermont legislature. At a time in America where politicians do more partisanship than they do getting things done for their constituents. At a time in American politics where we are all fed up with a lack of progress, with a lack of common sense, with a lack of compromise, and with a lack of unity, this Vermont legislature did what no other legislature is doing. Came together, worked together, debated real issues, and passed this bill. And that is a tribute to democracy in Vermont. We're going to hear shortly from some of the folks who made that happen. The Speaker of the House, Shap Smith, the President Pro Tem, John Campbell, and the chairs of the health care committees in both the House and the Senate that did extraordinary work to figure this one out. Representative Mark Larson and Senator Claire Ayer. To all four of them and the other 146 members of this legislature, I can't tell you how grateful I am. Did I get the number right? I think you forgot the Senate. Oh, what about the Senate? Sorry. You gotta remember, I started out in the House. We don't forget our roots, right? That's right. They always accuse me of running the Senate, and I just annexed it, right? 176 is never really. First, we're going to hear from a few of the folks that helped make this moment possible. Dr. Deb Richter, who came to Vermont as a doctor from New York, knowing that after watching patients suffer, after watching patients lose their life because of a lack of coverage, she decided, out of the 50 states, to go to Vermont and make people healthy, and in her spare time, work for a single-payer health care system that was going to allow her to practice medicine again and make sure that no one lost their life from a lack of coverage. Without Deb's commitment, we wouldn't be here today. She speaks for so many others. Ellen Oxfeld, James Haslin, the entire team that's worked so hard. Obviously the folks at VPIRG. You'll be hearing from Cassandra Gekas, from the healthcare advocate from VPIRG. Cassandra did an extraordinary job. Jennifer Schneider, who was diagnosed with cancer, ovarian cancer last year, and will share her story with us. Thank you, Jennifer, for your courage. And Julie Lineberger from Windham County, who is a business person who understands this from the inside. I give you Dr. Deb Richter.